Welcome to my YouTube channel, Learn with Professor Janula. In this video, I am going to explain about stages of labor. If you are first to my channel, don't forget to like, subscribe, and share this video to your friends. Labor is the natural process that helps a baby come out of the mother's womb. It happens because of strong and regular contractions of the uterus. These contractions make the cervix, which is the opening of the womb, become soft, thin, and wide enough for the baby to pass through. At the same time, the baby moves down through the birth canal, and finally, both the baby and the placenta are delivered. Labor is the series of natural events that happen in a mother's body to help the baby come out. It mainly involves changes in the uterus and birth canal, where the womb contracts and the opening gradually widens. These efforts finally push the baby, the living product of conception, out through the vagina, into the outside world. Now let us look at the characteristics of normal labor. First, labor should begin spontaneously on its own, without any medical induction. Second, the baby should be in a vertex presentation, meaning the head is the part that comes down first. Third, it usually happens between 37 and 42 weeks of pregnancy, which is considered the full-term period. Fourth, the labor should progress smoothly without taking too long. And finally, it should happen without any complications for the mother or the baby. Labor is usually divided into 4 stages. First stage, dilatation stage. This is when the uterus contracts and the cervix gradually opens and widens to allow the baby to pass through. Second stage, expulsive stage. In this stage, the mother pushes and the baby is delivered through the birth canal. Third stage, placental stage. After the baby is born, the placenta, also called the afterbirth, is expelled from the womb. Fourth stage, restorative stage. This is the immediate period after delivery, usually lasting about 1 hour, when the mother's body starts to recover and any complications are carefully observed. Let us now talk about the first stage of labor, also called the dilatation stage. The first stage of labor begins with the onset of true labor pains and continues until the cervix is fully dilated to 10 centimeters. It is the longest stage of labor, as it prepares the birth canal for the baby's passage. In women who are giving birth for the first time, called prima gravida, this stage usually lasts about 12 to 14 hours. In women who have given birth before, called multigravida, it is shorter and generally lasts 6 to 8 hours. The first stage of labor is divided into 3 phases. The first one is the latent phase. In this phase, the cervix dilates slowly from 0 to about 3 centimeters. The contractions are usually mild, irregular, and last for about 20 to 30 seconds. This phase often takes the longest, lasting around 6 to 8 hours, especially in women experiencing their first labor. The next phase is the active phase. During this stage, the cervix dilates from about 4 to 7 centimeters. The contractions become stronger, more regular, and more frequent, usually occurring every 3 to 5 minutes. Each contraction lasts for about 40 to 60 seconds, helping the cervix to open more quickly and allowing the baby to move further down into the birth canal. The final part of the first stage is the transition phase. In this phase, the cervix dilates from 8 to 10 centimeters, reaching full dilatation. The contractions are very intense, coming every 2 to 3 minutes, and each one lasts about 60 to 90 seconds. This is usually the most difficult phase of labor, but it is also the shortest, and it marks the completion of cervical dilatation, preparing the mother for the delivery of the baby. The second stage of labor begins once the cervix is fully dilated to 10 centimeters and continues until the baby is delivered. This stage is shorter than the first stage. In women giving birth for the first time, called prima gravida, it usually lasts about 1 to 2 hours. In women who have given birth before, called multigravida, it is even shorter, lasting around 30 to 60 minutes. During this stage, the mother actively pushes with each contraction, and the baby gradually moves down the birth canal until birth. The main features of this stage include strong bearing down efforts, where the mother pushes with each contraction. Another important sign is crowning, which is when the baby's head becomes visible at the vulva and does not recede between contractions. This stage concludes with the complete birth of the baby. The third stage of labor begins after the baby is delivered and continues until the placenta and membranes are expelled. This stage is the shortest, usually lasting about 5 to 15 minutes. During this stage, there are clear signs that the placenta has separated from the wall of the uterus. These signs include a sudden gush of blood, lengthening of the umbilical cord, and the uterus becoming firm, globular in shape, and rising in the abdomen. Once the placenta and membranes are completely expelled, the third stage of labor is considered complete. The fourth stage of labor refers to the first 1 to 2 hours after the delivery of the placenta. This is considered a critical period, as the mother is most at risk for complications, such as postpartum hemorrhage. During this stage, close nursing care is essential. The mother's vital signs should be monitored every 15 minutes, and the uterus should be massaged regularly to ensure it remains contracted. It is also important to keep the mother warm, comfortable, and emotionally supported. This is the ideal time to initiate breastfeeding and encourage skin-to-skin contact, which helps with bonding and stimulates natural uterine contractions. That brings us to the end of today's session on stages of labor. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.